We want to keep these really brief, really basic, and so we're not spending our time away from our families. So allergies are an amazing thing to treat. They're something that everybody has some kind of an allergen, I find, whether it's like the lady here in the picture where she's got runny eyes and runny nose, to possible a little bit of inflammation in the gut, some gas, bloating, to skin irritations and so forth. So there's a lot of different types of allergies, and I think if we can get a good hold, a good understanding of how to treat them, we can help a lot of people and also help ourselves into our future financially as well. So this is a quick picture of me, and I promise next month we'll get a better picture. But anyway, I've been a chiropractor, been treating now for 22 years here in Bountiful, Utah. It's just about 5 miles north of Salt Lake, and right now we're getting hit by a monsoon. We get a monsoonal flow every year in July, August, where we suck water up from Arizona and Mexico, and we get an afternoon big old thunderstorm. So we're having that right now, so you might hear a little thunder in the background. The types of allergies that I find that I treat mainly are ingested allergens, airborne allergens, and absorbed allergens through the skin. That's the main concept. So if you're working on those that are ingested, we'll be working with leaky gut, which we'll talk about in a minute. We're talking about airborne allergens. We're looking at molds, pollens. What you see on here on the right, that's kind of what we're looking at as you breathe that in. And then absorbed allergens through the skin as well. My son's on a mission right now down in Santa Rosa, California, and he was out helping some people and got into some really bad poison oak, and that was ingested or not absorbed through his skin. And for about 6 weeks he had major irritation and major weeping and so forth, but that's running down through the skin. So let's first talk about ingested allergens. Food allergens are things that we ingest and we get through, usually through leaky gut syndrome. And we've talked about leaky gut syndrome a couple of webinars ago. But as we eat and we become hyperpermeable, we allow things that should not be getting through, proteins that should not be getting through our gut, to pass through. Our guts become hyperpermeable versus semi-permeable. And now when you see the different foods that we're eating, we actually can create those, I can't remember if they're IgG or IgA allergens, but one of them is an allergen that you create a reaction immediately within a few seconds. Others are within a few hours, others are within a few days. So this is a different type of antigen-antibody complex that happens through our gut. But the food allergens, most often cow's milk, we find that in cow's milk, of the 70 known phenols, and I'll talk about phenols here in just a minute, of the 70 known phenols, milk has 50 of those phenols. So very, very allergic issue. The different nuts, of course, peanuts actually aren't a nut, they're a legume, and they actually grow in the ground. So we find that about 80% of those nuts have mold and fungus in them that is a very toxic mold. Eggs and fruit, MSG, yeast, so forth. So this is interesting. The World Allergy Organization claims that there are more than 250,000 preventable asthma deaths each year. And we find that asthma is an issue of allergen. It can be airborne, it can be exercise-induced, it can be also from just having the toxic liver, where if the liver is unable to get rid of its toxins well, it'll shunt those toxins and allergens up and out through the lung, and that produces the extra mucus and the congestion and inflammation. So if we can help that inflammation and the congestion, that's what we want to do, and we'll talk about that here in just a minute. The airborne allergens then, most common types: pollutants, fungi, mold, pet dander, dust mites, pollen. When you consider dust mites and dander and our own skin in our own beds, as we sleep, we exfoliate the different things that are within our beds. It's a pretty amazing thing that we're not all allergic to sleeping. But the idea, though, is these mold spores, the bacteria, the pollen, dust mites, and so forth, are inhaled into an already very, very sensitive tissue. That mucosal lining inside the sinus cavity and into the nasal passages is already inflamed. It's already very irritated. And they're usually irritated, I find, by layers of infection. We'll talk about those infections in a minute. But as I treat airborne allergens or people with issues in their breathing tract, the bronchioles and so forth, we want to look towards getting rid of those layers of infection so that you're diminishing the amount of inflammation, so that as we do get the bacteria and pollens and spores and etc., it doesn't create that histamine reaction, histamine release and mast cells and so forth, creating all of the runny eyes and so forth. So rhinitis, asthma, and so forth. So outdoor pollen is associated with over 300,000 deaths each year. Can you imagine? Outdoor pollen. So it's creating that reaction that then ultimately ends up with chronic obstructive pulmonary issues, and all of those things come from, again, I find layers of infection. So we'll look at that as we move. And then absorbed allergens through the skin. Chemicals, sunscreen, shampoos, cosmetics, detergents, toxins. So this is things in our environment that we're exposed to. And I have to admit, I don't really pay much attention. My daughter mows 17 lawns a week, and I'm out there occasionally with her trimming and filling the gas. You know, gas gets on me, and I don't really pay attention. I should, because ultimately my liver is having to absorb that and having to detoxify that. So your skin absorption, where the substance breaks through the skin layer and enters the bloodstream. It's got to make it through that fat-soluble layer of our skin and into the bloodstream, but it does it because a lot of the toxins are actually fat-soluble, so they can go through the skin easily. But as I've discussed, most of the allergens are created through the digestive system as the gut begins to be more permeable. So if you're looking here, this is nice and tight. These are villi, and the cells, or the junction between the cells in the gut, are tight junctions here, where when we become leaky, the junctions are broken, and instead of being semi-permeable, we become hyperpermeable. So that things like gluten, for example, in this picture here, can make it through and ultimately into the blood supply. Now we have antibodies that attract here and attack these antigens. And as these antigens are attacked, they create what's called an antigen-antibody reaction that creates inflammation. And this hunk of stuff, which would be the protein and the antibodies, then can settle out into joints, creating overall joint inflammation, and into the different tissues and organs, again causing inflammation. So every time we have an allergen, it's an issue where we're creating that overall inflammatory state in the system, whether it's inflammation in the gut, in the respiratory tract, or through our skin. So now let's discuss the concept of phenols. A phenol then is like a 6-carbon chain, like a stop sign, except for a stop sign has 8. But depending on the position of the different bondings, you can have a double bonded carbon on one spot and it smells like a skunk, a double bonded carbon on another side, it smells like a rose. So phenols are what create the allergen reaction. And it's through these phenols that we interact with our environment, and many times we become sensitive to the phenols. So what we want to try to do is diminish the amount of interaction. And we do that through supporting the gut, supporting the lungs, supporting the skin, and that's where we want to start to diminish that. Phenols are also within lectins. Lectins are almost like Velcro, and lectin will attach itself to sugars, specifically in the digestive tract. But the treatment with Inno-Vita is so amazing that you're going to be able to do so much in these 3 areas. So the treatment then, treating allergies, is to first increase the adrenal gland function and energy. We've got to get the energy up of the person. When we give the adrenaline, we work with the Adrenex. So that's supporting and creating a natural anti-inflammatory. Adrenaline is a natural anti-inflammatory. Next, we want to support the sinuses, the lungs, the bronchi for airborne allergens, or the digestive tract for ingested allergens. And then for our skin, as needed, we can also use the support formula from Inno-Vita for the skin. And rhodopsin helps to repair the skin all the way from aging spots to just healthy detoxification through the skin. So this is where it starts. It's supporting and getting the energy up. And I find that the Adrenex is just an amazing support formula to repair and rebuild the DNA function of the adrenal glands so that it's producing more healthy and effective cells, which then produce more effective and healthy adrenaline. So as we're looking at what supplements to use through this treatment process, Coltrax, Livergy, Adrenex, Permalung, X-Spleen, and Fulvicava. So let's go down each of these supplements and why we'd use it. So Coltrax helps to repair the leaky gut. So if we're talking about absorption and getting that in through our gut, we want to support it so that it becomes nice and those cells become tight, becoming from hyperpermeable to semi-permeable. And again, the Coltrax works with DNA function, as well as every other organ support formula is designed to repair DNA function, to repair prepare more healthy cells, which create more healthy tissue, ultimately healthier organs. So Coltrax for the colon. Livergy, this is your major filter and major chemical processor of the body. So making sure that the liver is cleansed and able to handle the toxins that are shunt to it, that its job is to detoxify. But many times we get overloaded in the liver because of the hyperpermeability of the colon. So Livergy, Adrenex, of course, to support and repair the adrenal gland. Permalung for any part of the respiratory, all the way from the sinuses down the trachea into the bronchi and into the deep lungs, helping to repair those tissues. X-Spleen is your major filter for the lymphatic system. As we're getting rid of these toxins and things that the remembrances that our antibodies have created that create the sensitivities to the allergens, we want to clean out and get rid of and move the lymphatic system, and that's done through X-Spleen. Not only supporting the spleen, but in the lymphatics as well. And then lastly, Fulvicava. This is just a tremendous support formula that works with fulvic acid for appropriate absorption of the electrolytes and absorption of overall tissue of nutrient. I have a life coach here in my office who's certified through Cornell and really knows her herbs and so forth. And when I brought home Fulvicava after the seminar last time, she was all excited to see what new supplements Inno-Vita had brought out. And as I showed her Fulvicava, she said, "Doc, everybody in your practice should be on Fulvicava. It's just so important for absorption and usability of nutrients." So that was pretty neat there. So this is more for treatment in the digestive tract. Let's now move over to the treatment of the airborne protocol, Adrenex, Permalung, Toxex. Again, the bronchial dilation and anti-inflammatory aspect of adrenaline. So if you think about some of the inhalers and the quick inhalers that we give patients with asthma, they're mainly adrenaline, the bronchial dilation. So most of the people, again, that are affected with sensitivities and allergens have low adrenal output. So we've got to get the adrenals up. Don't be afraid to use too much. The patient will feel a little bit of a buzz if they get too much, then you'll report that, and you can explain that to the patient prior. But I find breakfast, lunch, mid-afternoon, 3 a day is a good amount. But again, make sure you're doing your kinesiology. If you need help with kinesiology, ask Inno-Vita, and they'll send you a complimentary DVD that we created that will help you to understand more on your kinesiology. Permalung, again, supporting all the way through the lung tissue. And then Toxex is our chelating agent. And how I explain to my patients chelation or detoxification in this instance is I tell them, if you had a cabin up in the mountains and you collected the rainwater off of your roof, and all that rainwater collected into a 50-gallon barrel, 50-gallon drum, over time that rainwater would be very clear and clean. But if we're trying to remove the mud off the bottom of the 50-gallon barrel, we're going to have to bring that mud up through the clean water and out. Now, ultimately, when the mud is gone, we're still going to have dirty water. Well, that's what happens when we're getting rid of infections and so forth. So we want to put in Toxex as a chelating agent. So I usually spread my fingers apart, and with something small like a vial, a testing vial, I'll show how small pieces of toxin can pass through the kidney and liver net and stay in the blood supply. Okay, so I just keep passing that little vial through my fingers so they can kind of get the idea, oh, I see, the toxins aren't getting out. But when we put Tox-X in, then I grab the vial within my other hand, and I'll say those toxins, now that they're chelated or brought together, they can now get caught in between my fingers and then excreted. And I'll take my other hand and drop it down my arm as though it were being excreted out the urine and feces. So I explained to them the importance of using Tox-X when we're working with allergens, toxins, getting rid of layers of infection. So that's kind of how I work there. Now, when I say layers of infection, remember I was talking earlier, what we want to try to do is diminish the amount of overall inflammatory state in the body, so that when we do get an allergen, a little piece of pollen or mold or fungus or whatever in our nose, we might sneeze or something to clear that off, but we're not going to have a histamine reaction. So the histamine reaction, I feel, is because of, again, those tissues, whether it's your digestive tract or your bronchial or your respiratory tract, they are going to be irritated because of layers of infection. So again, here we're looking at the layers of infection: Bacto-X for bacteria, Meta-X for metals, microcyte for microparasite, those not seen by the naked eye, Paramac for anything seen by the naked eye, all the way from a head of a pin to a 6-foot-long tapeworm is done Paramac. The Fungex stops the fungus by stopping it from propagating so that it dies of old age. And then Viro-X for virus. Both RNA and DNA viruses are handled here. Real quick note, I talked about this last time, but while we're here, microcyte is to be taken for 40 days or so, constantly, continuous, where Paramac is to be taken for 10 days on and 5 days off, so that you kill the adult. The 5 days off allows the larva to hatch. And then we try to do that here in my office for 2 months or 4 cycles, so that you kill any opportunity or any chance for those larvae to hatch and become adults. Now note here, fungus is very common in the sinus and lungs, so use the Fungex. You can see it on the back of the tongue. You can see it behind the eardrum. It kind of looks like a little cauliflower behind the eardrum. You can tap on the gut, listening for air sounds. That's usually fungus. Vaginal discharge, generally fungus, especially with a white discharge that's itchy. 90% of the time that's fungus. Can be bacteria, but fungus is the one that you're looking at there. Very good. So those are the layers of infection. And then now for the ingestive protocol, we've got now the Adrenex, the understanding of why that is, getting the adrenal up. The Vivaprofen is the brand new, just coming out in our June seminar. Vivaprofen works with the inflammation of the gut as it puts in new good bacteria. So that one, Vivaprofen, then goes along with fluorescein. Fluorescein, both of those together work tremendously at reestablishing the good bacteria. You kind of want to use both fluorescein, and I didn't put that on the screen, but fluorescein and Vivaprofen together, because there are different probiotics in each of the supplements. But the Vivaprofen mainly works with the inflammation in the gut as it's putting good bacteria in, and the fluorescein is just reestablishing the overall bacteria. So I'll usually alternate. Take one Vivaprofen, next time take a fluorescein, and back and forth. The Coltrax for the digestive, anywhere from the mouth to the anus, it's reparative there. The Digesta is the enzyme for the digestion of protein, carbohydrates, and fats. Again, no animal product here, no ox bile or anything from animal. This is all from plant-based. And then the Leptera. Leptera is wonderful at, again, reestablishing good bacteria. It has good acidophilus and probiotics in it as well as digestive enzymes, and a very absorbable amount of vitamins, minerals, and amino acids. So Leptera, I have a drink of that every morning. That's my breakfast with some almonds. The other thing that I didn't put on here that we need to think of is the Integra-Cell. The Integra-Cell is the antioxidant that has the 8,000 milligrams of type A antioxidant per scoop. 8,000 milligrams. of type A. Now there's a difference between type A and type B. Type A will knock out 1,000,000 free radicals per milligram, where type B will knock out one free radical per antioxidant. So this is type A, 8,000 milligrams per scoop. So you're talking about 8,000 times 1,000,000 is 80 billion free radicals knocked out per scoop. Unbelievable. There's nothing like that on the market. Every afternoon I have a glass of Integra-Cell with a couple of almonds and mixed nuts and dried fruit a bit, and it picks my sugars right back up. I feel wonderful, and away I go again. So this would be more for the ingested protocols. 2. Yeah, that's designed for 2 scoops. And I usually put that in a shaker cup that Inno-Vita provides as well, nice shaker cup. I think they're 16 ounces, and then it comes in chocolate, vanilla, and berry. So when I do, right now I've got a nice big old garden. I got a garden the size of a chapel. It's huge. So I got a garden that I bring a tractor into, and I rip it up, you know, get it planted and everything, but I've got a lot of greens in there, kale and chard and spinach. So I have a green smoothie as well. So I'll put 2 scoops of the Leptera. Now this is for both my wife and I. So in my magic Vitamix, I don't have a Vitamix, I got another one, but it's like the Vitamix, and I'll shove that thing full of greens, 2 scoops of the Leptera, a scoop of Integra-Cell, a scoop of Cardiar for my cardiovascular. I'll put some mixed berries and fruit in it, handful of almonds, some oils, and whip that baby up, and it's a yummy green smoothie. So Leptera is a great one. It's a great one for stabilizing blood sugar as well. Absolutely. You can take any of, so I don't know if you've got, if you have your scan tray in front of you, or if you don't have a scan tray, order one. They're like $70 or so. They're under 100, but this, the scan tray, you can look at it, and in the center of your scan tray is all of the organ support formulas, and they're in kind of a green color. So Permalung is an organ support. So on your Permalung, you can pull that, and to your right in the scan tray are the orange formulas, and those are the infection fighters. So you could put any infection fighter with any organ support, because you could have literally any layer of infection in any one of these organs. So yes, the idea of fighting the infection is to direct it to that particular organ with the organ support. So like for example, if you had fungus in the lung, absolutely you would want to target the lung with the Permalung, and then key it at the same time with Fungex. So you're literally synergistically combining those together to help carry the antifungal into the lung. Literally saying to the system, we're wanting you to focus on fighting and getting rid of the fungus and supporting the lung at the same time. Now remember, Fungex helps, it doesn't kill it, it stops its ability to propagate. So it can't create more fungus. So it literally dies of old age, which is much more friendly than, say, diflucan, which goes in and kills it directly. Now the spore that's down deep into the tissue hasn't been affected. It kind of breaks off, and that spore then will just regrow. But if it's sitting there saying, okay, I'm happy, I'm doing my life cycle, I just can't create new young, and now they die of old age, that's a much more friendly way of hitting fungus.